Hi there, CPT ADDA community. Welcome back to the channel where we simplify the complexities of medical coding. If this is your first time here, make sure to subscribe and hit the notification bell so you don't miss out on our latest content. Today, we are going to dive into not one but two essential modifiers, Modifier 23 and Modifier 24. These modifiers might seem straightforward, but using them correctly can make a huge difference in your coding accuracy and reimbursement part. Have you ever wondering when to use a modifier for unusual anesthesia or how to code an unrelated ENM service during the post-operative period? Well, you are in the right place. By the end of this video, you will know exactly how and when to apply modifiers 23 and 24 to keep your coding on point and avoid denials. Let's start with modifier 23, also known as unusual anesthesia. This modifier is used when a procedure that normally doesn't require anesthesia needs it due to exceptional circumstances. It means any procedure that normally not performing under anesthesia sometimes may be performed under local anesthesia or regional anesthesia, but in some exceptional circumstances that particular procedure may require general anesthesia. In that case, we need to use modifier 23. For example, a minor procedure that usually only requires local anesthesia might need general anesthesia if the patient has a severe phobia or other condition that makes the procedure impossible to perform without the anesthesia. Okay? By attaching modifier 23, you are telling the payer that anesthesia was necessary in this unusual case. Right? Let's see the examples for the modifier 23. Here is a practical example I will tell you. Imagine a patient who is extremely anxious about a simple mole removal. Normally this procedure wouldn't need general anesthesia, but in this case, due to the patient's severe anxiety, the physician decided to use the general anesthesia. That's where modified 23 comes into the play. Okay. Let's take another example. A child who is uncooperative to undergo a routine dental procedure, making general anesthesia necessary. Okay. A child who is uncooperative to undergo a routine dental procedure, making general anesthesia necessary. Okay. Here patient is a child, he is not cooperating to the physician to perform the routine dental procedure. So physician decides to use the general anesthesia to perform that minor procedure. In this case also we need to utilize modifier 23 with the CPT code. Okay. Let's see another example. A pediatric patient who cannot tolerate a lengthy MRI scan under sedation and requires general anesthesia. In this case, modifier 23 would be used to indicate the unusual anesthesia. See once again, a pediatric patient who cannot tolerate lengthy MRI scan under sedation and requires general anesthesia. Okay, in this case we need to utilize modifier 23. Here patient condition is not supporting, patient is not cooperative with the lengthy MRI scan, so general anesthesia need to utilize to complete that MRI scan. So we need to utilize modifier 23. Okay, and second example also we have already discussed. Okay, so here you should remember few points while assigning modifier 23. Okay, documentation should include the reason why general anesthesia was necessary. Okay, any patient conditions or procedural difficulties that contributed to the need for general anesthesia. These points if you notice in the documentation, then you can utilize the modifier 23. Okay, usage criteria if you see for modifier 23, the patient has a condition that necessitates general anesthesia for a procedure usually done without it, or the procedure itself is a typically performed under local or regional anesthesia but specific circumstances require general anesthesia. Okay, now let's move on to the modifier 24. Okay, modifier 24 which is used for unrelated evaluation and management service by the same physician or other qualified healthcare professional during a post-operative period. Okay, so this modifier is crucial when a patient needs care for a condition that is completely unrelated to a recent surgery, but the visit occurs during the global period of that surgery. Understood, right? If one patient, for him already one surgery happened, he is currently in post-operative period and he came with the new complaint to that same physician who performed surgery recently, right? In that case, the condition for what he came now is completely unrelated to the surgery occurred recently. In this case, it is completely unrelated, so we have to utilize the modifier 24. Okay, by using modifier 24, you are indicating that the ENM service is separate from the post-operative care and should be billed independently. Okay, so what are the things you need to see while billing modifier 24 with the CPT code? See, ENM service must be performed by the same physician or group practice. ENM service must be unrelated to the post-operative care of the surgery. The service must occur during the global period of the initial procedure, right? Let's see some examples. A patient undergoes knee surgery and is in the post-operative period, then return with symptoms of cold. Since the cold is unrelated to the knee surgery, you would use modifier 24 for the ENM service. Okay, so patient already undergone with knee surgery recently and currently he is in post-operative period. Now he returned to the same physician with the complaint of cold. So this cold is completely unrelated to knee surgery whatever happened recently. So in this case we have to use modifier 24 with the current ENM service. Okay, to indicate this is completely unrelated ENM service during post-operative period. Okay, let's look at the another example. A patient has gallbladder surgery and is within the global period. They come in for a follow-up visit, but during the visit they mention new symptoms of chest pain. The chest pain is unrelated to the gallbladder surgery, so you would use modifier 24 for the evaluation of the chest pain. Okay, so already happened gallbladder surgery recently. Currently he is in global period and now came for the follow-up visit to the same physician. During this visit they mention new symptoms of chest pain. So chest pain is unrelated to the surgery which is happened earlier. Okay, so we have to utilize modifier 24 to indicate this current evaluation management service is unrelated to the procedure whatever happened recently which is in post-operative period. Okay, so let's see about common errors what usually coders will do. Common errors in modifier 23 and 24 application. See, for modifier 23 a frequent mistake is using it for procedures that typically require anesthesia. Remember always modifier 23 should use only for those rare cases where anesthesia is unexpectedly needed. Okay, don't use for the procedures which requires anesthesia. If a procedure can be performed under local anesthesia, regional anesthesia, or without the anesthesia also can be performed the procedure. For that procedure, unexpectedly with unavoidable circumstances, if general anesthesia required, then only you have to utilize modifier 23 with that procedure. Okay, so if any procedure that is normally requires anesthesia, then you should not use modifier 23. This thing you have to keep it in mind. And if you see common error for modifier 24, the most common error is using it for follow-up care related to the original surgery. It means most of the times people used to code modifier 24 where follow-up care related to the whatever the surgery happened. He is in post-operative care. He came to the same physician, but that complaint related to that surgery whatever happened recently. In that case you should not use modifier 24. Okay, you should use modifier 24 when the service provided is unrelated to that previous surgery during the post-operative period. Okay, so that's it for today's deep in dive into modifiers 23 and 24. Understanding when and how to use these modifiers can significantly impact your coding accuracy and ensure proper reimbursement. If you found this video helpful, give it a thumbs up, share it with your fellow coders, and don't forget to have a comment if you have any questions or suggestions for future topics. Thanks for watching. Until next time, happy coding. Bye bye.